And if we don't deal with these issues now, it could turn into things that you see happening in the news.
El Pasoan Nagoni Griffith was diagnosed with depression at age 19. Now she manages the disorder with medication, but acknowledges certain days are better than others. During some of those dark days, as she described them, Nagoni received care at the Extended Observation Unit at Emergence Health Network. It's a multi-bed facility created to care for individuals experiencing a mental health crisis. She says when dealing with a mental illness, it's important to know that strength comes from asking for help. Mental Health and You is an innovative new mobile application designed to educate the public about these signs and symptoms of mental illness and provide local and national resources for early intervention and treatment.
It's nice to be able to go to that app and press a button, and just by the press of a button you have all of the resources available to you. You don't have to worry about Googling what you're looking for. Everything is provided for you right then and there.
You can find the app at your mobile device app store. Search for Mental Health and You. Type in your zip code, and within seconds you have access to mental health community resources. And if you or someone you know is going through a mental health crisis, you can get help from trained mental health care professionals by pressing one single button.
When the person's going through a crisis, the last thing you want to do is, look in a telephone book or look on the internet going, okay, or, what phone number do I need to call? Just by the press of a button, you have somebody right there available to help you 24 hours a day, 7 days a week. So what a great resource there to have just when you need help, just by the press of a button.
It's a resource that Army veterans Frank Mond and his brother Darryl believe is beneficial, not only for our residents, but also our veteran community.
There's been studies done about secondary PTSD, the impact of mental health on the veteran's family, the wife, the kids, and everything, and it's a growing epidemic. Because you have kids, you have young men today and ladies who they did 5 years in the Army and they did 3 combat tours.
Exactly. It's something that the community can use, and it's about time that we actually use the technology we have available. I mean, it speeds up the access and everything. When things happen or when you feel down or whatever, you don't want to be looking for an 800 number or can I make an appointment or something like that. The red button, fantastic, you can hit it, and now you're talking to somebody that you can relate to.
The Mental Health and You app is also designed to create community awareness. Hit the Learn More button and read about the signs and symptoms of many mental health conditions. It's a feature that could prevent tragedies and even save lives. Unfortunately, individuals with severe, untreated mental illness can hurt themselves and lash out at innocent people. This can impact their family and friends, community, and sometimes strangers. If you are wondering about someone who is displaying signs of distress, the MH&U app is a valuable resource to have at your fingertips. Kathleen Payton is a board member at Emergence Health Network and active with other local agencies that provide mental health services in the El Paso community.
When I was in nursing many years ago, I worked at a psychiatric hospital for a time, and the stigma was great. No one would mention if the mental illness existed in their family in those days. There was just so much fear and guilt. And now people are becoming more open about it and recognizing that 1 in every 4 in our country is affected in some degree by mental illness.
Daryl Mon says he wishes he would have had access to the MHNU app earlier when he first realized his son was going through a mental health crisis. Many of us know what to do when our loved one is having a heart attack, but few of us know what to do in a psychiatric crisis.
And I stumbled. Mentally, I stumbled because I wasn't prepared to see the own crisis existing within my family, and especially my son. And when I was able to, had I had the application at the time, I could hit a button and say, hey, I'm seeing this with my son and everything. What do I do?
I hope that they have this app, because mental health is, people with mental illness are everywhere, some of them some people some people you don't know. Some people you'll never know because they take care of it so well through medication or other counseling or their behavioral services. You could be that person, or somebody else could be that person to provide that help for that person who needs it.